Respiratory infections can be a common occurrence in kittens, especially those in animal shelters or crowded environments where they are more susceptible to exposure. These infections can lead to uncomfortable symptoms and in some cases, serious health complications if left untreated. However, with proper prevention and timely treatment, these respiratory infections can be effectively managed in kittens. This video aims to provide you with essential information on preventing and treating common respiratory infections in kittens. Prevention is always better than cure when it comes to feline respiratory infections. Here are some key preventive measures that can significantly reduce the risk of infections. 1. Vaccination. Ensure that your kittens receive all the necessary vaccinations, including those for respiratory diseases such as feline viral rhinotracheitis, FVR, and calicivirus. Vaccinations play a crucial role in boosting their immune system and protecting them from common respiratory infections. 2. Hygiene. Maintain a clean and hygienic environment for your kittens. Regularly disinfect their living area, litter boxes, and toys to eliminate any potential sources of infection. Wash your hands thoroughly before and after handling kittens to prevent the spread of germs. 3. Quarantine. If introducing a new kitten into your household, it is vital to quarantine them initially. This helps in identifying any potential signs of respiratory infection before introducing them to other cats or kittens, minimizing the risk of transmission. For stress reduction, kittens are more prone to respiratory infections when they are stressed or anxious. Create a calm and stress-free environment for them, ensuring that they have access to a cozy and comfortable space. Minimize exposure to loud noises, excessive handling, or sudden changes that may cause stress. 5. Proper nutrition. Providing a well-balanced and nutritious diet is essential for strengthening the immune system of kittens. Consult with a veterinarian to ensure that you are meeting their dietary needs. A healthy and robust immune system is better equipped to fight off infections. Despite our best efforts, respiratory infections can still occur. It is crucial to recognize the symptoms early and seek prompt veterinary care to prevent the infection from worsening. Some common signs of respiratory infections in kittens include 1. Sneezing and nasal discharge. Excessive sneezing or a runny nose can be indicative of a respiratory infection. If you notice any discharge from the nose, it may vary in color, consistency, and odor depending on the severity of the infection. 2. Coughing and wheezing. Kittens with respiratory infections may develop a persistent cough or wheezing due to inflammation in their airways. This can be accompanied by difficulty breathing or rapid breathing. 3. Loss of appetite and lethargy. Respiratory infections can cause kittens to lose interest in food and become lethargic. If you notice a sudden decrease in appetite or a lack of energy, it may be a sign of an underlying infection. If you observe any of these symptoms in your kittens, it is essential to consult a veterinarian immediately. The vet will conduct a thorough examination and may recommend additional diagnostic tests, such as a nasal swab or blood work, to identify the specific respiratory infection. Treatment for respiratory infections in kittens may vary depending on the severity of the infection. Mild cases may be managed with supportive care, while severe cases may require hospitalization and more aggressive treatment. Here are some common treatment options. 1. Antibiotics. If the respiratory infection is bacterial, your veterinarian may prescribe antibiotics to eliminate the infection. It is essential to administer the medication as directed and complete the full course to ensure the infection is completely eradicated. 2. Antiviral medication. In the case of a viral respiratory infection, there are antiviral medications available that can help manage the symptoms and shorten the duration of the illness. However, these medications may not completely eliminate the virus. 3. Fluid therapy. Kittens with respiratory infections may become dehydrated due to decreased fluid intake. The veterinarian may administer fluids, either intravenously or subcutaneously, to maintain hydration and support their overall well-being. For nebulization, nebulization therapy involves the inhalation of medicated vapor, which can help alleviate respiratory symptoms and open up the airways in kittens. It is often used in cases of severe congestion or difficulty breathing. 5. Symptomatic care. In addition to specific treatments, providing symptomatic care such as keeping kittens warm, providing a comfortable resting area, and encouraging them to eat can help alleviate their discomfort and promote recovery. Remember, early intervention and proper treatment are crucial in preventing complications associated with respiratory infections in kittens. Always follow the advice and treatment plan outlined by your veterinarian to ensure the best possible outcome for your kitten's health. By implementing preventive measures, recognizing the signs of respiratory infections, and seeking timely veterinary care, you can effectively prevent and treat common respiratory infections in kittens. Providing a safe and healthy environment, along with proper nutrition and vaccinations, will go a long way in keeping your furry friends happy and infection-free.